Yeah, so we're live.
Okay.
I'm going to try to get us in the screen.
Okay.
Good afternoon. It's not morning anymore. I'm with Lauren Savage.
Good to see you, Brad.
One of my partners. Lauren actually had the wherewithal to build our facility. Had the vision, I would say. A lot of work went into it, but Lauren definitely had the vision, and I wanted to talk to you a little bit about that vision today. So we're at Ortho, Alabama. This is my practice. I don't really like to use this to talk about Brad Goodman, but I would like to talk about Ortho, Alabama. I would like to talk about that vision, and then I want to morph that into talking about urgent care, really in our community,
right?
A relatively new concept. So first, Lauren, if you could just talk about your vision and morph that into ortho urgent care for our listeners or viewers.
When we started talking about this, Brad, back in really 2006, 2007, it was to have a practice that would serve our community, that would be separate from the hospital, but we would have all the tools that we needed to take care of almost every musculoskeletal problem as an outpatient. So, as you know, we've got MR, CT, and those are hospital grade pieces of equipment. A 1.5 Tesla GE MR scanner, 32 slice GE CT scanner, 2 digital X-ray units. We have a AAAHC certified operating room that was built from the ground up with all the engineering standards and architectural standards for operating rooms in Alabama. And we have enough room to see our patients and to be highly efficient. We've got a pharmacy that's certified by the state and by the feds. We have physical therapy, so a lot of things that other people don't have, and to bring those all together in one place, it makes it really convenient for our patients. One of the things that we also wanted to look at early on, and we thought about before we ever built the facility, was urgent care. So we located in a place that people can find us. We're 1 mile off of 459 on US Highway 11 in Trussville. So that's a convenient location for people to access us.
So give us an example of a patient that would sort of be for the ortho urgent care type thing, where they would typically have to go to an emergency room and be seen, and could either come here like during clinic hours or even after hours. How could our viewers sort of conceptualize a type of patient that they might see in that scenario?
Well, if it's a major injury, say a dislocation of a knee or an open fracture of a long bone, an open fracture of the leg bone or the thigh bone, that's not a good patient to be seen here. But if it's a minor fracture of the hand, the ankle, or the forearm, those are things that we can think about, and we've got some pictures of that.
Let's show some pictures. What do you have up here?
So this first one is a hand fracture. It's called a boxer's fracture.
I'm going to come up here a little bit, Lauren.
Okay.
See if we can see that.
So this is called a boxer's fracture, and it's a 5th metacarpal fracture. So it's the metacarpal that goes to the little finger that I'm pointing to here. So it's just like this. It's that bone
I'm
right
not
there.
Focused. Now it's focused. Good. All right.
Okay, so it's this bone right here, and we can see the fracture here. So this ought to look like one of these guys, but we've got that sharp line, and this part of the bone is bent downward. And we see it on this x-ray also. So that's a boxer's fracture, and that would be a very appropriate type of fracture for us to see in urgent care. Ankle sprains would also be appropriate, things like that. And we've got some other x-rays we can look at.
I'll put this back here for a second.
Sure.
How would you have treated that?
So this, we can reduce that fracture. We can push on it gently if it needs it. Some of those don't need reduction. They can just be splinted. One of the things that we find with our urgent care, though, sometimes patients will come in during the day. The anesthesiologist will be here, and they can be taken straight to the procedure room, receive some sedation, get a reduction of a fracture, and have a splint or a cast applied. It's really a highly efficient way for the patient to receive very high quality, high-end orthopedic care.
Okay. You got another one there?
Yes, sir.
All right, good. I'm going to work on my skills. In fact, I'm going to not let you guys see. Okay. Now, okay. Because we have to be HIPAA compliant.
Right. Let's go to here's another one.
Let's see how I can do this.
This is another hand injury. And this would be an avulsion fracture. And it's this small piece of bone right here. So we're looking at my finger like this. And it's at this joint, the last knuckle.
Okay. I
And
see
there's
it.
the
I don't know
little
if
piece
they
of
see
bone.
it, but I hope they see it. Yeah.
Yeah,
So that's
right
an
there.
avulsion fracture. Would that cause the finger to be deformed ultimately? Or
It can give us a mallet deformity where the last knuckle drops down because the extensor tendon pulls that piece of bone off. So we would splint that, and that usually heals over. Actually, it takes a long time. It could take 2 or 3 months for that to heal. But that's a good example of the types of things that we might see that would be appropriate for urgent care.
Okay.
Major burns, large lacerations, lots of bleeding, probably not a good choice. Ankle sprains, things that you would see like
back pain?
back sprains. Somebody gets an acute back sprain. We typically don't see patients with chronic problems. So if somebody has chronic back pain.
Now we see them in our clinic.
In the clinic, but not urgent care
Not
so much.
urgently.
Right.
Urgently, you're thinking about things where, I guess you would call it minor orthopedic traumas as opposed to major orthopedic traumas.
It's a great way to phrase that. Absolutely. We're going to go to another X-ray.
Okay, great.
If that's okay.
Yeah, that'd be awesome. I'm gonna block y'all from seeing our screen. If there's any questions out there amongst our 2 viewers, please feel free to type them in.
Let me go back here. I'm sorry. When they enter a new study, it resets the screen. I have to go search again.
What if you hit their name? And I'll just block it out. Hey, Sarah. Sarah Bates is watching.
Hey, Sarah.
Shouldn't you be working?
All right, so this is another one.
All right, there we go. Let's see how I'm doing here. Okay,
Great.
looks like an ankle.
It's an ankle fracture. This is a fibula fracture, and we can see the line that's going right across the fibula. Obliquely across the fibula. So this is a minimally displaced distal fibula fracture, and this would be something appropriate for us to see. And one of the doctors or the mid-level providers would see this, get x-rays, provide the patient with a boot, and then would arrange for follow-up with the patient. So one of the things that we didn't talk about, the advantages to orthopedic urgent care, are that when the patient comes in, they don't have a facility copay like they would at the ER.
Oh,
They're
that's
not-
interesting.
Yeah.
I think you should say that again. So
So
they
it
don't.
usually saves you at least $150 to $300. There's no facility copay like at the emergency room. You also get the x-rays, so you're not trying to get the x-rays together the next day to take to a doctor. When you leave here, you've got an appointment with the doctor that you need to see for follow-up. So you're not scrambling around trying to arrange follow-up the next day yourself, trying to negotiate for a better appointment time.
I see.
So, and you're not sitting in a waiting room full of people with the flu or an abdominal virus,
Right.
a GI
And you're
virus.
not hopefully waiting around hours and hours and hours.
No, we're usually pretty quick, usually pretty fast during the day and in the evening. So we're open till 8 o'clock, Monday through Thursday, 8 p.m., and then Saturday 10 to 2. So let's see if we can get
One more case, and if there's questions, because people are actually showing up on my screen here, so I know people are watching, but if there's any questions you have for Dr. Savage, now's the time. Get them out. Oh dear. Oh wow, that looks like my arm.
Do you have one of those?
Actually, your dad fixed
did.
my
Good.
my radius.
Is that from hockey?
Yeah, that's from hockey. So yeah, I'll tell you that story. That's a good story, actually. Why don't you do this one first?
Okay, so this is a mid-shaft ulna fracture. It's one of the bones in the forearm. It's right in the middle of
Yeah, my
that bone.
ulna, not my radius. Excuse me. Misspoke.
And most of these can be treated without surgery. So if you come in to see us, what we do is we get the x-ray, we'll put you in a splint at first, and then maybe a cast later on. And usually after about 6 weeks, that's healed.
So years ago on a Sunday night, playing hockey,
Uh-huh.
I went into the goal post.
Uh-huh.
I got checked from behind. I went flying into the goal post, and I hit my my forearm here
Uh-huh.
and broke my ulna.
Okay.
And that was Sunday night. So I went home, took some Advil, put some ice on it, put an Ace wrap on it, stayed up all night because I was in pain.
Right.
And the next morning I was doing blocks actually at OPCC, and so I had one of the x-ray techs x-ray it while I was there.
Right.
Sure enough, I had a fracture. And then I did my procedures, kind of, with one arm, with one hand, and then that afternoon your dad put 8 pins in there. Didn't miss a day of work.
Good for you.
All right, let's see what else we got. So anyway, that's my story. I'm sticking to it, and we probably could. I don't know if we could pull up those images or not. Maybe we can pull them up. I don't know. There's a ton of me in there. Clear. Let's see here. Nope, just my shoulders in there. From, well, this is a good one too. This is from squash recently. That's my left shoulder. Here's my right shoulder. Here's my right shoulder. Here's my left shoulder. So I was playing a squash tournament a week ago.
Okay.
And I went, because I don't really know what I'm doing, I went flying into the concrete wall. And I basically hurt my AC joint. I have severe tenderness over my AC joint. And so I was just getting an x-ray to sort of look at that joint, which it looks fine to me.
So a grade 1 type sprain. So
Right.
that's something that we would see. AC joint injuries are something that we would commonly see
Right.
in orthopedic urgent care. Absolutely. Very appropriate.
So yeah, it still hurts, by the way.
Let's take a while to settle down.
It's a problem.
Yeah.
And it's there's a hematoma, not a hematoma, but you can see the blood, the bleeding from the bruising.
So
from
if there are
the
people
injury.
that want to play you in tennis or squash,
Now
now's
is
a good
the time.
time.
That's right, but I'm still playing. All right, Lauren, I appreciate you doing this.
Thank you very much, Brad. Enjoyed it.
If cases come up, that are interesting,
Sure.
and we're around, we should just on the spot
Sure.
do one of those.
Absolutely.
All right.
Enjoyed it. Thank
Enjoyed
you so
it.
much.
Thanks so much for
See you.
sitting in today.
My pleasure.